you to Doris. She's a 72-year-old lovely lady. It is a made-up name, so don't think that I'm just breaking any patient confidentiality. She was admitted to one of the hospitals with fall. And she had been through multiple hospitals during her journey throughout the hospital stay. She was once in the acute hospital setting, which is what we call our bigger hospitals, where we do all the things that we need to do for a fracture after a fall, and then we transfer them to something we call community hospitals or the rehab centers, where they go through a period of rehab before they go home. So while she was in the rehab hospital, she was seen by one of the pharmacy technicians on the ward, and she shared that how she was managing her medicine at home, and she has been doing that very well. However, now she's been in the hospital for more than 2 months, and she doesn't know which medicine she is on at the moment. In the beginning, she tried to understand what she's taking, what changes are happening. And she was told that she's just getting anxious about her medicine, so she shouldn't do that because there are very capable people looking after her. She shared with the pharmacy technician that she felt that she wasn't being anxious about her medicine. This was just an attempt to know what is happening to her medicine in terms of what changes are being brought in. So when she goes back home, she can take them when she goes back. And she shared that after so long, she has no idea where her medicines are. The color and the shape of medicines often look different compared to what she's used to of taking them at home. And currently, she doesn't feel confident or comfortable that when she's ready to go home, she will be able to take her medicines at home, and that makes her very worried. This is not a one-off story, and this is not a one-off conversation we have on our wards. On average, I probably get 3 patients who are pretty much in the same boat, that they were taking their own medicines when they were home. For some reason, they were admitted to hospital. And for background, because I work in frailty, they probably will be in hospital, unfortunately, for a little bit longer because of their overall health condition, and as a result, they might stay a bit longer in the hospital. And because they're not taking any medicines, and the tablets we use in hospital may have different color or shape, they lose the confidence. As a result, there has been an effort throughout the years, I think probably for past 20 years, across all the organizations in Wales, that we should have a provision in the system to enable. We've brought this term enable. Previously, it was a little bit allowed because it's against the policy, to enable patients to take their medicines in the hospital while it's deemed right and safe for them. There has been very successful trials all across Wales in different organizations. However, because of the perceived risks that come with patient taking their own medicine, has always taken priority compared to looking at the patient independence and possible deconditioning that happens by taking the independence away from them of managing their own medicine, has always taken priority. I was tasked earlier this year to look at all the policies available across all the organizations in Wales, because they all have slightly different provisions within their organization, with an aim to produce an all Wales framework, which will enable patients when they're admitted to hospital to take their own medicine. This is a piece of work that had came out of another piece of work that was done a couple of years ago, reviewing pharmacy services across Wales in all the hospitals. And one of the recommendations was that we need to improve patient confidence and independence while they are in the hospital setting. One of the reasons I signed up, I sort of put my hand up to say I really want to work on this piece of work, is because of a little bit of a personal experience, which is a little bit different from Doris. My husband had a motorbike accident last year, and he was admitted to hospital. He was in the hospital for over a month. He had multiple fractures, and he needed to go through rehab as well. Before going to hospital or having that accident, he was working as a HR business partner for HGIW. Very capable man, takes multiple medicines because of multiple health conditions he had. None of them had stopped him ever to live an independent life. Lots of medicines he take were actually for prevention for a lot of things that happen as a result if he doesn't take them. While he was recovering, all the medicines were given by nurses, absolutely fine. But when he was discharged, after his discharge, he had to have multiple sort of attendance to A&E department, because unfortunately that was the only way he could access the treatment he needed to access, often scans and stuff for his new symptoms. And every time he'll end up in A&E, he wasn't allowed to take his medicines. And one of the very common thing that he suffers with is migraine, and he's on three different medicines to prevent migraine from happening because he gets very bad migraine. And every time he was in hospital, his weeks were full of migraine because that 2 days or 6 hours or 12 hours he was in A&E, he was not able to take his own medicine until the pharmacy was involved and nurses could give his medicine. Um, and that really got me thinking that there are lots of people out there. Yes, there are people who probably will be very sick and not able to take their medicine safely. But having been with him on all those occasions when he was in A&E and we were just not able to give him the medicine, even though I was there as a healthcare professional, even I couldn't support him with that. And I could see the effect it was having on him, and also the frustration that he would always have to say, why am I becoming incapable? Why can't I do it myself? This needs to change. And I was like, I'm sure there are lots of people out there. So just give you a narrative why this is important for people living out there. We have done the work on producing an all Wales framework for our patients who will be attending hospitals in the coming years, and enabling them to take their own medicine if they are able to do that, and also feel they're confident that they can do it. The framework has gone through the first part of consultation in September. The consultation is concluded and will be taken for outcome and review next week to OPAG. Throughout this time, one thing was really on the back of my mind, that we as healthcare professionals are very passionate and keen about making this change happen for our patients. But throughout that time, I haven't actually spoken to the patients to say, how would you feel if we were saying to you, you should take your own medicine because you can, or because you were taking it? You may have lost the confidence, but what support do you need from us on the ward to get that confidence back? So by the time you go home, you can go back to how were you before. Lots of patients. Another thing that I would like to share with you, just for the knowledge and awareness purpose, because all of our experience and journeys look different, is lots of time we do have to discharge patients when carers have to administer the medicine to them for this very reason, that they now have lost the confidence or ability to take it themselves. But what that really means is if that person takes the medicine 4 times a day, because that is the regime, then they could just be home all day waiting for the next call of care to turn up. They may not be able to go out for a meal with their family. They might not be able to have a day out because they have to have that medicine 4 times a day. They don't know how to take it themselves, and the carers will have to do it. Across Wales, different health authorities, with regards to social care, had different policies as well, which means some authorities will allow the patient to have that day off, and some authorities will have to have different arrangements in place. It becomes pretty much a punishment for patient to be on medicines which are very important for them, and then lead on to other problems. For example, people not wanting to take medicine because makes their life worse from quality of life point of view rather than from their disease point of view. So these are all the reasons that we are very keen as healthcare professionals to bring this provision within the healthcare setting. But I'm just very keen to hear from you. Either you have had a hospital admission yourself, or you've been with your loved ones or your friends, and you feel. And what do you feel that if the patients are offered that you are very capable of taking your own medicine, you're otherwise well and healthy, I think we should get you back on taking your own medicine yourself. How do you feel about that?
Oh, thank you, Rafia.